Nose surgery, or rhinoplasty, is one of the most common plastic surgery procedures. This procedure can help the patient to correct a structural deformity or a functional problem such as reduce or increase the size of the nose, correct the asymmetry of the nostrils, straighten the curvature of the nasal bridge, lift the tip of the nose, change the angle between the nose and upper lip, correct a birth defect or injury, relieve respiratory problems due to deviated septum. People who wish to have this surgery must be over 15 years of age, since this procedure can only be performed after the nose has reached its full development. It is not advisable for pregnant or lactating women, nor for people with coagulation and cardiovascular problems. The surgical procedure can last from 2 to 4 hours approximately. For a correct evaluation of the patient, the doctor will carefully separate the skin along the columella by pulling it upwards. Using surgical scissors and a series of retractors, the physician will continue to very carefully remove the skin from the underlying cartilage, which is the cartilage that extends from the nasal bones to the septal portion. Once the skin of the nose is detached from the nasal bone, the surgeon will be able to make the necessary corrections to the nose. Open rhinoplasty allows the doctor to better modify the nose in patients whose tip is wider or protruding. The specialist may choose to remove a portion of the alar cartilage, which is what helps define the cosmetic contour in nostrils. Likewise, the surgeon may choose to use sutures to direct or draw the alar cartilages inward in order to create a nose. These side effects are not worrisome and will disappear as the days go by. The stitches, bandages, and nasal splints should remain on for 5 to 7 days, depending on the doctor's indications. As the days go by, the inflammation of the nose will decrease, and after 30 days, it will look more uniform aesthetically. However, it is possible that the final results of rhinoplasty will be reflected up to a year after the procedure.